Hello, Assalamu alaikum, and welcome to a very special edition of our program Health is Wealth. I am your host, Shabnam Riaz. And right now, for this episode, we have actually changed the venue, and we're going to talk about something that is very, very important, not only for Pakistan, but globally as well. And the topic of today's discussion is actually the state of nutrition. To talk about this, we are going to talk about the movement SUN or SUN, which is Scaling Up Nutrition Movement and Initiative. We're going to talk about how that is working in Pakistan, how the collaboration is going on, and how is Pakistan benefiting from this movement. So to talk about today's topic, we are very, very honoured to have with us in the studio the Honourable Minister, Madam Saira Afzal Tarer, the Minister of State for National Health Services. Thank you, Madam, for joining us here today. Seated next to her is Ms. Gerda Verberg, the coordinator for Scaling Up Nutrition Movement. Thank you very much for being here. And we also have Dr. Francesco Branca, the Director for Nutrition and Food Safety, WHO. Thank you, sir, for joining us here today. So with this highly esteemed panel that we have today, we're going to talk about nutrition in Pakistan and what is being done to, alleviate the problems that we have here. If I could start with you, Ms. Gerda Verberg, the Scaling Up Nutrition Movement, or SUN as is the abbreviation, it's a very interesting abbreviation, Sun, rising, it has all that positive messages with it as well. What exactly is it all about?
It is a movement that was initiated by the UN under the recognition that nutrition is very important for everyone, because it means health, it means that you can live a prosperous life, but it's not only to be seen from the health perspective, but you also need good food, you need good sanitation, you need fresh water, you need education. To be short, you need a lot of different sectors to work together in order to fight undernutrition and overnutrition. That's one thing. The second point is that already back in 2010, people realized that this cannot be done by donors, this cannot be done by the UN. You need ownership and leadership of the country itself. And last but certainly not least, if you want to get better nutrition, of course you need policy and politicians, but you need also the different stakeholders, civil society, people within the communities, the private sector has to contribute, academia, the UN, but also donors to support the implementation. So you need all players to come together, to agree upon how to move on, and then to move on in order to get results that are scalable. That is the idea of the Scaling Up Nutrition movement.
Right. That's really very interesting that a whole collaboration of so many stakeholders are coming together. Dr. Francesco, we come to you. Can you tell us about the state of nutrition globally, just briefly, and also in Pakistan? What are the challenges that we are facing?
Well, in the world we face what we call the double burden of malnutrition. We have multiple forms of malnutrition. We still have 156 million children in the world who are stunted, which means they don't grow enough. They're very small for their age. And we still have over 40 million children who are wasted. It means they are very thin. And both these conditions of undernutrition are very problematic for future development. And these conditions are also present in Pakistan with high prevalence. We have almost a child in two. Exactly 44% of children under 5 in Pakistan were affected by the stunting. And then we have about 4 million children who have these forms of acute malnutrition, the wasting. But at the same time, we have in the world a shortage of certain vitamins and minerals that give, for example, rise to a condition in women particularly of iron deficiency, and in women the form of it is anemia. And this is invalidating because it affects reproduction, it affects working capacity and well-being of women. But then we have at the same time another form of, we can say, excess nutrition. We have the overweight. We have too high weight than actually need it. And this is an epidemic which is growing in all parts of the world. It's not only a problem for rich countries, it's a problem increasingly for low and middle income countries, and Pakistan is no exception. Pakistan has about 40% of the women who are overweight and obese, particularly in urban areas.
Very interesting. Madam Minister, now that we have been through experts which are telling us about the Scale Up Nutrition Initiative and also the state of nutrition in Pakistan, how does Pakistan benefit from this initiative?
Thank you very much. First of all, let me tell you that this malnutrition among children or women is not simple. It starts even before pregnancy, or even at the age of a girl when she becomes of a childbearing age. What I feel that Sun is helping us a lot, and also the WHO. A recent survey of National Demographic, which I and Hassan Iqbal launched, that was an eye-opener. And the alarming situation which we are facing in nutrition, is 40% of our children are stunted, most of them are wasted, more than 50% of our women are anemic, deficiency of vitamin A, deficiency of vitamin D. All these challenges which we are facing. And I don't know, when I looked at the scenario, that where we went wrong. And especially after the 18th Amendment, when health was devolved, there was no nutrition cell or anything at federal level which can deal with all situation. Now, the only support which we had was from our technical partners, from international donors, Sun, UNICEF, DFID. So they are helping us. So at present, I think you can say that 80% of the work which provinces are doing, that is with the help of the federal government. In technical areas, they are developing the PC1. We supported that. We helped all the nutritionists who are posted in the districts. So I think with our partners and through these international, helpers, we are helping. This is an area which we are forcing. We are very clear that the role of the federal government is to develop coordination, to facilitate them in capacity building, in technical support, to develop guidelines and then give it to the provinces. And at the end of the day, implementation is with the provinces. So what we can do is that at federal level even, so we have frequent meeting. We have constituted a National Fortifying Alliance where we meet frequently, and with all the health minister. But let me tell you one thing, that this is a huge challenge, which is not possible only for the government to take care of. And another thing, that we need a multi-sectoral approach. Now, I am a health minister, but in this area what we need is that the health ministry, food ministry, your social welfare ministry, and also the women empowerment ministry, they have to sit together and devise some mechanism which we have already devised. And then the role of the planning division and finance is very important, because they are the one who are going to take the lead. And at the end of the day, I say that the political commitment and the role of the leadership is also very important. And you can see the difference in those areas where we can have this political leadership. And you can see in polio, you can see in vaccine management. And the good thing is that even in nutrition, right from the Prime Minister till at the lower level, now the ownership of this nutritional plan is there.
As you mentioned, Madam Minister, that early, this all starts even before a baby is born, conception as well. So how much would you say that traditional influences make a difference in this predicament?
This is the biggest challenge which we are facing, that is the mindset and the behavioral change. Now, it is a proven fact that the early 1,000 days are the most important for a child. It is right from the conception till he or she is of a 2 or 2.5 years of age. Now, even in our houses, we know the focus is on the diet. You will eat this, you will drink this, and you will have a fair baby, and you put somebody beautiful picture in the room. That is. Nobody told us, even at when I got pregnant, or even at the present, that how these 1,000 days affect your child. So I think what we need is, and recently there was a seminar and also a conference from Education Department, on which the academia, the nutritionists and world people from all over the world came, and the emphasis on the early 1,000 days. So I think the biggest challenge which we are facing is that we have to educate our women, and also the men. We have to educate our health providers, our LHW, the biggest force which we have, that how they can make this awareness campaign among the masses, that how important this woman is. You know, the environment around a woman, and especially in rural areas, her husband, her mother-in-law, and especially another thing which I want to mention, that you know, after first or second baby, and unfortunately, I will say unfortunately, and if they are girls, the state of the mind of mother is very different. So we have to take care of that, and I think it's the responsibility of the state, and especially in public health hospitals. We should have psychiatrists, we should train our gynecologists and then pediatrician, that you have to give lectures, you have to give, you know, brochures to the women, to the families, that how you have to take care of this pregnant women.
Absolutely. It seems that we need complete assertiveness and to take this matter on a war footing, in fact. Ms. Verberg, how do you start with addressing the problem of nutrition when you're in a certain country? How are the facts and figures gathered, and what challenges lie in that department?
First of all, let me totally agree with what the minister has said, because it all starts with behavior change, and therefore we need all people within the community, both men and women. We also need men, because they are brothers, they are fathers, they are leaders, they are religious leaders. So they need to champion this idea of behavior change and taking care of young children, because they can pave the way towards a very healthy community and a prosperous future for this beautiful country. So that's one thing. The other thing is that Pakistan has signed the Sustainable Development Goals. It is, and Pakistan was one of the leading countries to sign these goals. And the Sustainable Development Goals are developed by all countries in the world, dealing with education, poverty, the position of women, innovation, peace, prosperity, water, sanitation. All the important things in life are there. And Pakistan was one of the first signers of the Sustainable Development Goals and is implementing them. But for each and every Sustainable Development Goal, you need nutrition as a foundation. Right. So you will not end poverty in this beautiful country without investment in nutrition. You will not make it possible for children to be better educated or to develop better their brains and their body if you don't get nutrition right. You don't reach innovation nor peace if there is not the right nutrition. So that is one thing, and it is also the topic we have been discussing so far during our visit to Pakistan. And I have to tell you that leadership in government, the several ministers we met, and other people in the public service, but also the different stakeholders, civil society, private sector, the UN, to deliver as one, and the donors are ready to join forces, to work together, but especially to focus on implementation and results, because that is what's crucial here, and then you can make very quick progress, I think. There is one unique thing in Pakistan that I want to mention. Pakistan is the only country out of the 59 countries that are a member of the Scaling Up Nutrition that has a platform of academia in all kinds of universities around the country of Pakistan. They stand ready to support implementation. They stand ready to support the government and the different stakeholders to really improve nutrition, to train people, to educate people, and to build the future leaders, the students they have at their university. So I'd like to compliment and to commend Pakistan with this fact that you have even a platform of academia who stand ready.
That's very encouraging indeed. And exactly as you just mentioned, it's something that has such a domino effect on everything. Everything is interconnected. And this is the main focus and the main foundation that we need to grow on, as you have very rightly identified. Dr. Branca, if I could ask you, what areas have you found in Pakistan, if we speak about the demography of the country, that are proving to be the most challenging?
Well, I think the challenges are spread throughout the countries, and we see some differences between the urban areas and the rural areas. We clearly see that people with low income are more affected by food insecurity, by malnutrition because of their access to food and access to services. But we have seen an incredible capacity of policymakers, of communities to react to that. So there is something happening. There are policies that are aimed, for example, at reducing the inequities. Pakistan is a country which, unlike many other countries in the world, is reducing inequities. And this is good news. There is a very important social support program which is reaching several million families, and that is really helping reduce inequalities, improve nutrition, improve access to education. So this is really a way to create a country that builds on its human capacity. It's the future of the country. We have heard that the malnutrition affects 3% of the global domestic product. So if we didn't have malnutrition, the country would have overall 3% more gross domestic income. So this is something that really requires this coordinated effort from all sectors.
Right. And as you very rightly said, that you have the differences in different areas, the urban and the rural. What about maternal malnutrition? Because that was raised by the Minister as well. Isn't that something, I mean, are people aware enough of how crucial this is?
Well, clearly maternal nutrition is absolutely key to ensure the health and nutrition of the future generation. The baby conceived as a program that will be rolled out throughout the life. So a stunted mother, a mother who is small or a mother who is undernourished, will most likely give birth to a small child.
Exactly.
And we already have, by the 6th month of age, about 1/4 of the children who have these forms of poor growth. And so this is really creating an intergenerational cycle of malnutrition. Unless maternal nutrition is sound, then we're not able to break that cycle. And the children who are stunted, the children who are born small for date, will also be likely to have more chronic diseases. So it's not something that you will see in terms of increased mortality in the first 3 years of life. It's a lifelong basically effect, with people having more diabetes, more heart disease. So early nutrition is absolutely crucial, and early nutrition is something that can be dealt with relatively simple measures. One of them, for example, is the provision of iron and folic acid supplement. This is really crucial. It has to start as soon as possible in life, even before conception, for girls to be there at the start of the pregnancy in absolutely good shape. But there's also another challenge, and that's the early start of pregnancy. Girls who marry too early and have a baby too early basically have a competition. There's a competition between the growth of the child and the growth of the mother, and both will suffer. So both the health of the mother and the health of the child will be penalized by this poor nutrition.
Absolutely, and that's sort of...
That is why we in the Scaling Up Nutrition movement used to say focus on women, adolescent girls and children. But to do this, you need the men to support them and to support the family and to support their
So how are we
community.
generating this sort of, how are we getting men on board? How are we reaching out to them? How are we sort of educating them as well to understand the importance behind this?
To tell you, they are everywhere. In every room they are decision makers very often, and if you could reach them and convince them to be a champion, I think there are not many men that do not want their community or their family to thrive and to have a prosperous future. So if you count on men to contribute to give the wives and the girls, the daughters, and the adolescent girls an opportunity to live up to the best potential, you're creating a bright future for your country. It's investment in human capital, and human capital is the most important capital for a country.
Of course, Madam Minister.
Yeah, actually I just want to say a few things. When we talk about as a society, unfortunately there is some pockets of Pakistan where there is, some cultural issues, some social taboos, wrong interpretation of, religion. There are some tradition which still we follow religiously, even in urban class or even in elite or educated class. As far as, this challenge is concerned, what comes in my mind as a strategy, that especially in public hospital, in rural areas, all the gynecologists, all the health providers, they go and they educate the men. You can't plan a baby without the consent of your husband. So what they do, that they convince them, they provide them with certain, material, literature or brochures, that now your wife, your daughter-in-law, your daughter is pregnant. Now what you have to do, that this much, these are certain things which she has to take. Folic acid, it's the responsibility of the government, and they are providing. I know, in few provinces, they have started doing them, providing folic acid, administering tetanus injections, and then iodine.
Are we taking enough use of our lady health workers as well?
Actually, that is an area where lady health worker, primarily their job was, family planning and educating mothers. But unfortunately, they are everything except this. But now they have also starting, they have, in different provinces, because that is an army which we have. They have access to each and every household. So even, the male and the female, they feel comfortable with them. They are allocated with certain houses where almost LHVs, especially I can see in my constituency, they have become a family member. Because they have to go there for polio drop, for routine immunization, for everything. So they consider them as their family member. Now what challenge we must include its importance in the curriculum. Now you can see different advertisement by different religious scholars just on to focus breastfeeding.
Exactly.
That is another area which I want to throw some light. Pakistan is among those countries where the breastfeeding is not only static, but it's decreasing. Previously, it was in the working class, or you can say educating women, but now even in the masses, we are the biggest country who use this bottle feed. Right. So what we have to do is that in our public sector, in hospital, I always focus on public sector because masses go there. So that is an area where the gynecologists, the nurses, they in fact stress on the mothers to have breastfeed. And the importance of, early elimination is very important. I personally feel that what we need, when I talk about that multi-sectoral approach, that we sit together, we focus on area, that these are the challenges. Here we have to focus on health side. This is an area where the population, most of the women, they go to population planning centers also. So when we feel that this is challenge which we are facing. So in Punjab, they are focusing on the 11th districts, which are in southern Punjab. Another question you asked from WHO person, that was that what are the areas in Pakistan
that
where
we need to concentrate
So there are some districts which the burden of malnutrition is much higher as compared to other. Now we have a national demographic survey, which is one of the most authentic. They mentioned each and every district. They mentioned each and every area that where we have to focus. And I think the good thing which I was just discussing with my colleague, that what we are, that the sensitization and the realization is among the provinces. All the 4 provinces, they have developed their PC1. We help Balochistan. We help the Azad Kashmir and other are federally administrative areas. So those PC1 are with the planning ministries. So the good thing is that the government are allocating, all the provincial government and federal government, we are allocating our own resources for this nutrition program. So we are not only dependent on SUN or UNICEF or DFID, and this is another thing, and right from the top leadership, Prime Minister also instructed us that along with the maternal and child health agenda which we have developed guidelines and we have conveyed it to the provinces.
Right, that's very encouraging as well. So right now we're going to take a break and we'll be back with more. Stay tuned. Okay, and welcome back to the program. We are certainly, very honored to have this esteemed panel with us today, and we're talking about something that is ever so important, something that is entrenched into society, and it's actually the building block of a healthy life and a productive life, in fact, as well, and something that is a global concern, not just something for Pakistan, extremely basic. Well, and now I'd like to talk to Ms. Berg and ask her that let's talk about the nutrition markers and makers for development.
Yeah, it's of immense importance that the Ministry of Health is involved for the health guidance and services, etc. But we also need on board the Food and Agriculture Department to review the food system. How can a country like Pakistan, with a lot of agriculture, how can you produce healthy and nutritious food? How can you create jobs, for instance, already in the rural area to start the food value chain? And how can you, for instance, provide school meals or school feeding that keeps the children in school, both boys and girls? Because if parents know that children are fed well and they get a nutritious meal when they go to school, it's a more of an incentive, and it helps the children to stay fit and to focus on brain development rather than listening to their stomach. Well, I have to tell you, good nutrition is not always a lack of food, but it's the lack of the right food. But it's for sure it's helping. Another topic is sanitation, also in schools, but also in the household. Is there enough potable water available? But also, are there rules taken into account of how to maintain hygiene and sanitation? In schools, for instance, it is crucial that there are restrooms, toilets, separately for boys and for girls, especially in secondary education. Because if girls start to have their period, they really need a decent room to take care of themselves. Otherwise, it's quite likely that they will drop out.
Right, absolutely. Dr. Branca, you mentioned earlier the phenomenon of stunting and wasting. Could you tell us a bit more about that in detail and affecting Pakistan?
First of all, let me tell you that if you look at globally at the risk factors for dying early, the maternal and child malnutrition is number 3. If you then look at obesity, it's number 6. But you know what is number 1? Unhealthy diet. So top of the list of the causes of death, what we call the global burden of disease, we have unhealthy diet and poor nutrition. So it's absolutely critical. Now, what is happening in Pakistan is that in terms, for example, of healthy diet, we have, fortunately, the majority of family who does not have access to adequate diet. I think the calculation is about 58% of the families, which means not only not having enough energy, but not having the diet of the right quality. It means vitamin, the minerals, all the nutrients which are required by a healthy body. But there is also a risk that Pakistan is now a low and middle income country, so the income is risen. And there's what is called the nutrition transition, the dietary transition. So the system of food is changing. And you have more and more people living in urban areas. By 2030, I think the majority will be living in urban areas. More and more people relying on processed food. Exactly. Now, if that processed food is high in fat, sugar, and salt, it's a disaster. So we are creating even more food insecure people because the quality of the diet is actually not conducive to good health.
Which is in fact quite, you would think that you would equate not having the right food with having the lack of being able to have food or something else like that. But as you said, it is the rise of the lifestyles of processed food, fast food, that is contributing to this, is it?
Well, I think that's what Minister and Head already said. I think it's a combination of two factors. One is people's behavior, but the other one is the food environment. I mean, if the only food you can find in your corner shop is poor food, then that's the one that you can afford because it's cheap, then you're going to buy that one. So no matter how good education you have, you'll buy that poor food. But at the same time, if you have the best available food and you don't appreciate it because, for example, the marketing pressure on certain foods which are considered, sort of a higher quality is that strong, then you also make the wrong choice. So it's really this combination of, good education, which starts, of course, in school, which requires good information to consumers through, shows like this one, to the TV, to the radio, to the newspapers, but also, control of marketing. If we have marketing of unhealthy food, particularly to children who are not really able to make the right choices.
They are the target.
Exactly.
Exactly. Yes, that's absolutely true.
But there's also good news because the density of cell phones in Pakistan is almost 100%, both boys and girls, women and men. It is possible, and I think it's happening already, to submit good, nutritious behavior messages through the cell phones. I think that's an important thing. The other thing is the involvement of private sector companies. Not only the food companies, by the way, but companies should be invited to contribute to better health and nutrition also in Pakistan. It's not about making a business case about trying to get children acquainted to sugary beverages, etc. It's just rethinking the business case and investing in Pakistan to provide everybody with the right and nutritious food for a fair price, and at the same time contributing to the future generations of this country. It's not easy, but every country, including Pakistan, has to have this constructive but also critical dialogue, and we totally support them because at my level, as Assistant Secretary General of the UN, I'm really strong on inviting private sector companies to step up, but also to make a healthy business case when it comes to good nutrition.
Absolutely.
But with adequate government regulation, if the government regulations are not in place, this is not going to work. I mean, Pakistan, for example, has established a taxation on sugary drinks. That's really important. And we understand that the increase of the population is higher than the increase in consumption. That means it has an effect. Maybe you can do even more than that. even labeling, for example, having clear information on the products. This food is high in fat, sugar, and salt, so eat less of it.
Yeah.
Yes,
I think that's
No, actually we are doing that, and in regulation, I feel that we have to do, there are many standards which we have to meet. But unfortunately, when we talk about Pakistan, all these challenges, it's not only that Pakistan is facing, even in a developed country.
It's a worldwide
the
phenomenon.
malnourishment is not an issue, but obesity is an issue. I mean, this free delivery, and somebody comes to your home at 2 o'clock or 3 o'clock, and they are offering some deals. So even that is also a challenge for developed world also. So what I feel that the challenges which we are facing are not different from other countries. And sometimes when we talk about malnourishment and malnutrition and child and mother mortality, the poverty is the first thing which comes in our mind.
Exactly.
But fortunately, Pakistan is a food surplus country. So at least in my constituency, I know not a single man or woman sleep without food at the night. Nobody's on the roads. So the slums and all these, we are still lucky that we are not facing that much challenge as our regional countries are facing. But unfortunately, as I mentioned earlier, that what we need is a behavioral change in mindset to include this nutritional and all these health thing in our syllabus, to focus on adolescent girls, to make, and media can play a very important
That's
role.
exactly what's going to be my next
media
question.
now, the TV, they have accessibility where even the LHW doesn't have, so they are even in the bedrooms of the people. So in electronic media, and previously I wrote a letter to Pembra chairman Absar Saab to kindly persuade our all the media houses to allocate some prime time for these social sector activities. Whenever you have some, and they are working on that, and there are some very good people and anchors who always ask, we always focus on the days. When there's a Women Day, there's a program on the, so when there's a polio day, so nutrition is such a, but I know after all they are people, businessmen, so they have to highlight those issues which are very sensational. But at the end of the day, I think that such programs like which you are doing today can create some awareness. But unfortunately, this program is also in English.
True.
So what we can do is with translation, we can also telecast it so that our masses can understand
And we can
it.
also have a similar program in
Urdu,
in Urdu
or
and other
even in a regional
languages
languages
as well.
Radio can also play an important role. So this is what I've discussed with the UNICEF, that what you can do is that it's not only for polio, but UNICEF role is for mobilization. That is an agency, UN agency, which always play an important role in social mobilization, in making some awareness among the public. And I think now, instead of giving ad or advertisement in the newspaper, we should focus on electronic media, on radio,
Influencing.
some messages from other people, because changing eating habit and behavior change is a massive challenge.
And how about celebrity endorsements? Because people are very, very influenced
this is
by
what we are
those
doing.
as well.
I mean, you see Wasim Akram in diabetes, medicine ad. So this is another area that which we can do is, but in health sector, demand is not there. What we have to do is to create demand in the public, and among massive is a massive challenge.
Do we sort of need to put a bit of a glamorous sort of touch there and brighten things up so people are attracted
Exactly. I mean, that
towards
is
it?
another area, and this is what I've exactly discussed with the UNICEF people, that you have to make a little 30-second, 1 minute an ad, and then we have to go to the media just to educate our people that by eating too much is not healthy.
That doesn't mean
That
that
doesn't
you're-
mean that you are going to be.
Exactly.
And unfortunately, even in the babies, in the formula milk babies, another thing which I want to mention is that we have laws. We have legislation. We don't have to do another legislation. But for the implementation of those laws, there are, I mean, this is, I don't know that after this program, maybe the formula or all these companies will come to me. But, by portraying and by showing that if you will drink this formula milk, if you will have this porridge or baby food, your baby will become a fat and healthy and beautiful looking. So that is another area which we have to focus. that we have to discourage all such activities.
Yeah, and exactly, that's a very important point you've just raised. Dr. Branca, as we were, just talking about the confusion between actually being overweight and being healthy, that's such a cultural sort of a thing behind that as well. How do you deal with educating people that way? Is there enough public awareness being done?
I think this issue about the culture of the shape of it's being widely debated because you have different role models in different parts of the world. So definitely it is something that we need to take into account. But probably the role model is something that is more important. I think from our point of view we need to explain what is the value of having a healthy weight. What is the value of having a healthy growth? So it's not about the extremes, but about getting the best out of a good body shape, about having a healthy diet, about having an active life. So all that is related to health and well-being. I think these positive values are
also related to emotional well-being as well.
Sure.
Emotional well-being, absolutely.
So role models in society are important. Pop, music role models, sports models.
Targeting the youth as well.
Yeah, targeting the youth as well, because there it's where it starts. Identification.
Yeah, which we always forget and which are very effective, that still we have certain areas in Pakistan where religious scholars and the local tribal systems have a lot of influence.
Yes, a lot of
So, when we talk about the respect of the women, the health of the women, when we talk about the role of a mother, whatever is in a religion or society, it demands everything. It demands the priority in health sector, priority in, when we talk about women empowerment, it is we need a multi-sectoral approach. You won't believe that still in some rural areas, there's a difference between the diet of a son and a boy.
Absolutely.
There's a difference, discrimination, rather discrimination in their education, in their medical treatment. I just want to share a data.
Not, if I could just interrupt you, not just the rural areas, it's people who are even
you
living
won't
in the
believe
cities.
there's a data, a very astonishing data, which I was comparing, that after this introducing this Prime Minister National Health Program, the load burden of the disease on women's side is much more as compared to men. The gallbladder operation, sterectomy, even angioplasty, everything. And when I asked them, they said that I was suffering from this disease, my husband, son or whoever, my father was suffering from this disease. So when I go to public sector, there was a long queue, and when we go to private sector, that they said that you need 25,000 for this surgery. So they prefer male to have their surgery in private sector rather than the women. So the change of attitude, and I was just discussing with the representative that from last 8 years I'm in politics. Being a female and directly elected woman, I attended a seminar on women empowerment. I attended and go to the international conference on gender equality. Then I am dealing with health. In my last tenure, I was dealing with the education. The core issue and the bottom line of all these challenges and health indicators, social indicators, is to focus on adolescent girls, on mothers. We have to work on child marriages. I totally agree. And birth spacing. So when you have to focus on your girl, adolescent girl, it starts right from the birth. The confidence, actually we are talking about the diet, what about the confidence which you got? Exactly. So the role of the father initially, the role, and mothers have also the similar feeling. But unfortunately, they have, sympathy, they have the same love for their daughters also. But when they look at the society, they feel insecure without the son, without the father. So right from the beginning, nutrition is, bioproduct of all those things. And this is the reason that what we need is that we have to focus, even if we have to include in the syllabus, the respect,
It's something
the
that
importance
has to
of
be
the women.
drummed into.
It is in the air.
Yes.
You know, it is in the air. What we have to do is, I know it's worldwide. It's not only the Pakistan. The role of the parents, the role of the religious scholar, the role of the political leadership. Now, what we have done, the Prime Minister recently, you know, the passing this honor killing bill was a huge challenge. So, I mean, these interventions are made by the governments, but at the end of the day, it's the father, it is the husband, the son. So, as a society and the role of everybody, wherever we are, if we have to look even in our religion, if we will look even in our social, the respect of the woman, the importance of the women, that is there.
It's the translating, absolutely, as you're saying, the translating of the implementation of a mindset. That's something very abstract. That's something very hard to deal with. How do you?
It is. But as I have already emphasized, it is also pointing at men that we need all of them. We need brothers to be a careful brother. We need fathers to bring their daughters up as equal.
Exactly.
Yes.
So how do you go around, you know, promoting this? What awareness campaigns are being done?
What I feel that if we will be able to realize a father that whatever you have, whether a son or a boy, a son or a daughter, male or female, this women's health will affect their brain, their body. So, I mean, you know, if you want to have a healthy and a normal son, so you have to focus on the mother.
So true, absolutely.
You know,
true.
this is and it not only affects their physical development, a stunted child or a wasted child, only, but it also, you know, affects their brain also. It affects their intelligence level also.
Yes, it's a
So
vicious cycle.
And it's not only the health, you will also have to take care of our mental health also.
And the whole climate.
Provide them an enabling environment in which they can have a healthy, normal child.
The environment at home, the whole climate, everything. Ms. Berberg, you're also saying, you know, something that learning from each other is something that is very, very important in your initiative. Tell us about that, please.
Well, we are visiting not only this country, but we have also visited Nepal, for instance. I've been in Indonesia and in other countries. So I'm traveling to visit to see what is ongoing in countries. One of the representatives of, I think it was Kenya, told us, we women are brought up as second-hand people. We do not count. So we have to overcome this, but we have to, at the same time, teach men that they have to play their role, because it's also in their advantage. If we are brought up with a feeling and a recognition that we are equal human beings, life is so much more bright and prosperous. We can make use of all the opportunities and possibilities. And it's not about to focus on the differences of position, etc. It's just to bring boys up like girls. For instance, I'm very blessed. I was born and raised in a family of 10 children. I have 7 brothers. And my parents told us, you're totally equal. For that reason, my brothers had to learn to cook, wash the dishes, clean the windows, do the beds, etc. And I was born and raised on a farm, so I can milk cows by hand. That is equity, because it is it enters your brain,
and it's practicing the environment at home through parents.
Exactly.
The way they deal with their children. That is exactly what is setting down the rules
and
for those
you know
children
what?
to learn.
My 7 brothers are now proud of the sister because of where I am and what I'm doing, and they praised themselves and said, well, we have invested in our sister to bring her where she is right now. So it's a shining example of how it's,
isn't it?
Yeah, sure.
That's so true.
And I recognize it, of course.
Right, and you just have on the program. Dr. Francisco, let's talk about your current visit to Pakistan at the moment, and you know, any surprises, any things that you thought, you know, maybe were they needed more sort of attention, or something that you thought, you know, that this is actually better than we had thought.
As Hedda always saying, this is a beautiful country. I've seen very little of it, so I hope to be able to have more chances to see more. But no, yes, a lot of surprises indeed. I mean, it's a country with which is changing a lot. Of course, there are, as we heard, we discussed many challenges, but we see energy and the will to address those challenges. And particularly, I'd like to appreciate the Minister of Health for her focus on infant nutrition. I think this is really key. We in WHO attach a lot of importance. My pill of wisdom is almost like the elixir of long life. 6 months exclusive breastfeeding, 2 months continued breastfeeding, even beyond, if possible. It's really important for good nutrition. You prevent overweight, you prevent undernutrition, and you have a good emotional
attachment between mother and child as well.
Your intellectual quotient is high, and so forth. So this is an area where I've seen a lot of attention, still a lot of challenges. I mean, we have, Minister was saying, 38% of the children are exclusively breastfed, which is more or less the global average. But this is the best thing that a child could get. So we should get 90% at least, because only few people live in situations where they need bottle feeding. Still, Pakistan is a country which is probably the largest user of bottles for children in this part of the world. So positive surprises, surprises that will lead us to work more, to look for solutions. We're always looking in WHO for examples to share. I mean, the policy development is done based on previous experience on policies. So, for example, all we're hearing about approaches to taxation of sugar-sweetened beverages, also from Pakistan, will benefit other countries of the world who want to take that particular action. So if Pakistan will find a way to bring up again that proportion of exclusive breastfeeding, then that will be a good lesson from other countries. I heard the minister wants to work more on baby-friendly hospital environment, and so all hospitals could be made really appropriate for breastfeeding. I don't know, Minister, whether I can disclose that. Maybe it's your thing, but I heard that you're creating breastfeeding rooms in important places of the country.
Inshallah, in a day or two, we are going to inaugurate a breastfeeding room in Parliament House.
Oh, wonderful!
Along with Speaker's
That
House.
is great.
So
that is exactly, and these are the things we're talking about that makes all the difference.
And also, previously, I know at least in Punjab, when we worked on women package, so we recommended, and at least in public secretariat in Punjab, they have a daycare center. But again, we need to change a mindset, because in our country, mothers and we as a family, we don't take our children. We prefer and we trust our grandparents. And unless and until we have some Filipinos at those daycare centers, nobody will bring their children. But at least to start with, I think this is an area. And there was an amendment which was proposed that in any institute, whether in private or public sector, if more than 5 women are working, they should have a daycare center, where at least they have a facility where they can feed their,
Absolutely
babies.
True, because as you said, it's okay to have theory, it's okay to talk about this till sun up till sundown. It's actually providing
we have to work on
facilities.
All sides. Provide them facilities, educate them in masses, so at least nobody can have any excuse that we don't have that facility. So I think this is an area.
These are the positive surprises we want to hear and communicate to the world. As Greta was saying, we have these sustainable development goals which really give nutrition a great opportunity, because nutrition is underlying all of them. And the General Assembly last year declared the next periods of 10 years, particularly a decade of action for nutrition. So all this good news that we are hearing from our countries, we hope they will make into formally commitments. So we know that the government of Pakistan is committing to create breastfeeding room in all public institutions. It's an important commitment. Other countries will take that example and do the same. And collectively we'll see an advancement in nutrition. That's what we want.
Absolutely true. And as everybody has been mentioning, it's the combined efforts at every level that is making all the difference. Unfortunately, we've run out of time. We were having a wonderful discussion, and I'd like to thank you all so much for being here today. Madam Zahra Afzal Dar, the Minister of State for National Health Services, thank you for taking out time from your busy schedule to be here today, Ms. Gerda Wenberg, the coordinator for Scaling Up Nutrition Movement. It was a pleasure to listen to you as well. And Dr. Francesco Branca, the Director of Nutrition and Food Safety, WHO. We also benefited so much from your expertise as well. Thank you so much for being here today, and unfortunately we've come to the end of this program. There was so much to talk about, something, you know, that we really do we really take this seriously? Do we really think about this? Is this something that we just take for granted every day? Nutrition, you know, it's something that we really should focus on and understand the implications to everything that we do today is going to impact our tomorrow. So until next week, bye-bye.